2 new cases this morning, 6 cases on Monday over the weekend. If we look at the last 2 cases, they're both females, ranging in age from teens to 40s, all in Simcoe County, or both in Simcoe County. One is associated with an institutional outbreak, and I'll be speaking more about that, and one is a sporadic case. One is a close contact of a case, and as I said, one is part of an outbreak. And they are in home isolation. So indeed, we've had an elevation of cases this week. So for the past month, we were having a downward trend and had gotten down to very low case count. If you look at the week, though, of August the 16th, from the Sunday to the Saturday, not including the beginning of this week, we had a total of 11 cases. So that's up from the previous week of August the 9th, where we had 4 cases, and the week before that we had 7 cases, and the week before that, July the 26th, we had 13 cases. So unfortunately, our downward trend has ended, at least for the moment, with a bit of an upward surge. And I will discuss implications of that later in my report with, I think, some reflections about what we need to do. If we look at all of our cases, a total of 91% of them have recovered to date, 627 cases. We have 1 hospitalized case not in the ICU. We currently have 21 individuals who are in self-isolation. We have no new deaths, so a total of 37 deaths. And if you look at the trajectory of cases with this increase over the past week, we now have an incidence of 2.4 cases per 100,000 population per week, as opposed to the previous week where it was 0.5 per 100,000 population. So quite a substantial increase. And also our reproductive number is 1.2. So anything less than 1 means that the pandemic is shrinking. If it's above 1, then it's growing. So at this point, we are, as reflective of the numbers, have had an increase, a growth in the pandemic. So in terms of our institutional outbreak, we have an outbreak at Mill Creek Care Center in Barrie, and that was declared on August the 24th, involving 1 staff member and no cases known to be among the residents. At this time, affecting their 2nd floor. So we're testing all of the residents on the 2nd floor and all of the staff throughout the entire facility. We don't have any results that have come back as yet, given that we've just initiated that. And we've otherwise put in place the standard control measures to prevent transmission through the facility. In terms of some key messages for us, we have a rise in cases. We note that the most significant driver for that would be people socializing among family members, larger groups, potentially beyond their social circle of 10 people. So what's really key here is staying within your social circle of 10, and it's got to be the same people all the time, and everybody in that group has to view it that way so that you don't have overlapping social circles. That's really key. So if you want to socialize beyond your social circle, you can do so, but you need physical distancing then. You need 2 meters set back from those people. So one way would be to have them in your backyard and have the 2 meters back from those individuals. And preferably, you know, if you have other people over, they should be in their social circle. You really can't be having people from multiple social circles in a confined space, because it becomes very difficult for everybody to be 2 meters apart. We are finding that our contact investigations are becoming more complicated as time goes on, that people are tending to have larger encounters with larger numbers of people, so that now we might be having 7 or more contacts per case, whereas a month ago it would have been 3 rather than 7. So that speaks to perhaps some of the driver behind this, and it speaks to the importance of people really taking to heart that we only keep this under control through our collective efforts. That if we relax our control measures, then it's going to go up, and we will potentially lose control of the pandemic. So it's all up to us. We have to maintain these practices. If you're encountering people beyond your social circle, you need a 2 meter setback. If you're in an indoor public place, you have to be wearing a mask. You need to be doing hand sanitization. If you're feeling unwell, you need to be self-isolating and seeking assessment and testing. People need to be monitoring themselves for symptoms. The other thing we would note is we find that there's more in the way of contacts in the work environment. We haven't had transmission in the work environment that we know of as yet, but we've had contacts in the work environment. And that speaks to the importance of people exercising these practices in the work environment as well, that we need physical distancing, and people need to be using their masks. If they're in the public portion of their work environment, then that's required by my direction to businesses and organizations and transit operators. But even when you're working in a place that's not part of the public, you've got to keep your distance, and if you can't do that, you should be wearing a mask, and there should be support from the operator of the premises that this be in place, and the management of the flow of people so that they're not having encounters face-to-face with each other, and that there's support for people to be doing frequent hand washing. And also screening, that employers need to screen their employees for symptoms and have them excluded from the work environment and advised for testing if they develop symptoms. So 2 takeaways. People in their social circles have to protect your social circle, maintain your social circle of 10 people, the same 10 people all the time, everybody in the same, abiding by the same group, and people have to protect their work environments as well. So we're less than 2 weeks away from the beginning of school, and the health unit, of course, is working very diligently with our school boards as they prepare. We have reviewed their operational plans for commencing schools. I have met with the directors of education. We have meetings to support the school boards. I have a meeting with one of the school boards itself, the board members. We are doing virtual town hall meeting panels via one of the school boards with parents. So as you know, as I mentioned before, we put out a written communication to all the parents via the school boards and have that up on our website with a dedicated page on our website for return to school and some basic information about what's being done to help safeguard school environments and what parents and students need to be doing as well. Certainly there's roles for us all in this. So the roles for the schools and the school staff are to put in place the measures that the school boards require to safeguard the school environment. So this means maintaining physical distancing for everybody in that environment as much as possible, cohorting students into a single class that they stay with, the younger grades in particular, but I understand that the high school grades as well, they're going to be doing that with regards to the courses that they're in, so that if there is a case that transmission is confined to the one class and not throughout the whole school, it makes it much easier for us to follow up and put those people into isolation. That there's enhanced cleaning measures of sanitation, that face coverings, masks need to be used for children grade 4 and up, and for younger grades encouraged, and that parents need to be screening their children before they go to school and excluding them from school if they develop symptoms. So at the school itself, they need to support that, and if in fact children or staff are noted to be ill at school, that there's a requirement for them to be isolated and for public health to be notified. Roles for caretakers or parents are as follows, that parents are to support their children in their hand hygiene, in training them to do frequent hand washing, coughing into the sleeve, so cough etiquette, and physical distancing. All of that, you need to be helping your children acquire those skills, and helping your children stick to their cohort as well. Perhaps when they're out in the playground, for example, as much as possible, sticking to the same cohort as in the class. And that the parents support the children in becoming familiar with and becoming comfortable with wearing a mask and how it's to be done correctly. Assessing the children, of course, before they go to school to make sure that they're ill, using the checklist resources that would be coming from the school boards, and keeping them home and seeking assessment if their children are ill. Of course, the health unit, we have our roles as well. Our role is to provide information and guidance to anyone who needs it, to the school boards, to the school boards, the schools, the parents, make it broadly available to respond to reported cases of COVID-19, to work with the school and assess any such cases and exposures in the school environment, and identify contacts to be isolated and recommended for follow-up for testing, to take other actions required, declaring outbreaks if we deem that there is an outbreak in a school, and to lead in the way of public communication with regards to the response to situations such as outbreaks in schools. So we remain deeply engaged in the topic of preparation for the openings of schools and following through with the openings of schools once it takes place. We also are busy at this time hiring staff. So the province has supported us to hire up to 20 nurses to support our work in schools with COVID-19. And so in a staggered fashion over time, we're going to be proceeding with hiring nurses to do that very thing. We've done some internal reorganization of our school health team in order to better position them to be aligned with our COVID response team to be efficient. And we are also looking at other resources as well that we need to put to the COVID response and protecting the school environment. So just a few updates on other matters. We have up on our website a mitigating harms of COVID-19 public health measures report. This was a review that we did of the literature looking at the harmful impacts of the control measures put in place to prevent transmission of COVID-19. What we found was that the isolation and the confinement of those measures had measurable impacts, when we look at the literature on the topic, measurable impacts on the general well-being of children, youth, the adult population, people living in low income, and those with who use substances. We noted, for example, evidence of increases in symptoms related to mental health distress, and increases in the consumption of substances such as alcohol, that there was reports of distress in children increases in domestic conflict, and also some negative impacts on access to services at the height of the restrictions. That in particular, some of the populations that I already identified, those of low income, for example, were more deeply affected by these matters. So our report identifies some mitigation strategies that could be pursued to address these things now and into the future. If we have to go back into more restriction in the future, that we as an agency, but also we would recommend decision makers in government take these things into account, the availability of the services to help mitigate these harms. We feel is important. Thus, we put this report up on our website. We've got another report on our website with regards to COVID-19 infection and links with ethno-cultural diversity areas in Simcoe, Muskoka. So in the past, I've spoken about a preliminary review that we did that demonstrated that neighborhoods with a higher proportion of the population being of ethno-cultural minorities had a higher incidence of COVID-19 compared with our general population in Simcoe, Muskoka, and this is in keeping with the findings elsewhere in Ontario. However, there is research elsewhere in Ontario that suggests that people living in neighborhoods with material deprivation, lower income, less housing stability, usually are more affected by COVID-19. Usually those are neighborhoods in which you have a higher incidence of COVID-19. We didn't find that here. There's quite an unusual finding. We found that instead, in the neighborhoods with higher ethnocultural diversity, it was those neighborhoods that had a higher income or lower material deprivation that were affected more by COVID-19. So instead of poorer neighborhoods, it's better off neighborhoods that also happen to have a high degree of cultural diversity that are more affected by COVID-19 here in Simcoe, Muskoka. So this is a different finding compared with what is typical in the province. We are looking into this further to see if we can understand it better, but it may very well be that it correlates with the fact that we see the highest concentrations of COVID-19 in the southern portions, southern municipalities in Simcoe, Muskoka. Those are municipalities closer to parts of the province, other health units, other municipalities with a much higher incidence of COVID-19. And it may very well be the working populations in these neighborhoods that are working south of here that potentially are picking it up in their work environment or picking it up in public transit. So it might be a reflection of the workplace and transit dynamics in those communities. So that's also information that we have up on our website. I have an update with regards to changes in our assessment centers. So first off, assessment centers in Muskoka, Algonquin, in the Muskoka area are changing. As of August 31st, Muskoka Algonquin Health Care will be providing one assessment center that will be located adjacent to the helicopter pad at the back of the South Muskoka Memorial Hospital property in Bracebridge at 75 Ann Street. The locations that had been up until now in Muskoka and Huntsville and Bracebridge would not be continued. And however, in addition to the one site that will remain, Muskoka Paramedic Services will be continuing to provide testing to individuals who cannot get to that site because of life circumstances. They'll be continuing that service into the fall. I also note that the Midland Assessment Center is moving to Georgian Bay General Hospital campus effective Friday, August 28th, to the clinic building on the grounds of GBGH Midland site, moving from its current location at 845 King Street, Midland. So we have a couple of media questions that were submitted in advance. One says that the Minister of Education says if health units need more time before the return to school, the government will listen. Are there any plans for the Simcoe Muskoka District Health Unit to delay the opening of schools in our region? So I would say at this time we've not made that recommendation or request. We've been in close contact with all of our school boards. We've reviewed their operational plans for opening schools. I have met with the school board directors. I'm aware that they are taking a staggered approach through the first week of the openings of schools, allowing for different grades to come through in succession through the week as a way of making it easier and to, I guess, observe the impact of the arrival of the students, a more cautious approach. We're satisfied with the plans that we've seen. We are certainly looking forward to the release from the province of their COVID outbreak guidelines for schools. We have been assured they'll be coming within 24 hours, and in fact I've seen an embargoed copy, so I'm quite certain that will be coming, and they're well crafted, and I think that we'll be able to apply them well with the schools. So at this time we've not recommended or asked that there be a further delay in the commencement of the schools. The next question, the province allocated $50 million for school heating, ventilation, and air conditioning systems, HVAC. Are HVAC systems a concern? Is there something schools should be doing to their systems to decrease the chance of spreading COVID? So indoor air quality has certainly been raised as an issue with regards to COVID-19, and the recommendations generally call for bringing in fresh air as much as possible into an indoor environment to create an approximation of the benefit of being outdoors to reduce the likelihood of transmission of COVID-19. And there's recommendations that the ventilation systems be kept optimally operational and clean, that they undergo that kind of an immediate assessment, review, and preparation so that they're operational to the optimum. But beyond that, the evidence of actual transmission reduction through HVAC changes is really, really very, very limited. And so I think it's important that school boards use these funds to make sure that their ventilation systems are optimal, and that they look to means of allowing fresh air to come into the indoor environment as much as possible. But at this point, beyond that, we're not actually particularly concerned in Simcoe Muskoka about this topic. We're more focused on the other control measures that I've already cited earlier in my discussion today, my presentation. So that takes me to the end of the topics that I've got for today on my list. I'd be happy to take any questions or comments at this time.
Okay, thank you, Dr. Gardner. Let's start with Adrian Prasidi at MISM. Do you have any questions, Adrian?
Yes, actually. The only thing I was, hi, Dr. Gardner.
Hello.
The only thing I was curious about was that you keep mentioning masks, distancing, and remaining in your social circle, but at the same time you're encouraging kids to go back to school, and for many that means taking the bus. Are you concerned concerned about a really large increase in cases for kids on the bus?
So I would say that the school environment in general it is going to lead to some transmission. We are seeking to have it contained and controlled as much as possible, and to be able to detect it early and respond to it. Transit in buses would be one of the ways in which that's possible to happen. The control measures that they're looking at there is the use of masks in the bus for the same grades that I've already cited, grades 4 and up, and for the younger grades that they'd be encouraged to wear masks. Certainly the bus driver to be protected. And spacing within the bus as much as possible, children from the same family to be in the same seat, and arranged seating, same setup of the seating for like a allocated seating for the students. If there is a reduction in use of the bus, then that would allow for more spacing. And in my discussions with the school board directors, I've heard that may be the case. There might actually be a larger proportion of students that are going to be choosing other means of getting to school. There's a certain number that will be choosing to remain at home as well. So that can help with reduced numbers on the bus and allow for greater spacing on the bus. But I agree that it's part of the profile of potential risk exposures associated with opening up the school. We do believe that it's important to proceed with opening up schools because of the benefits of health and mental health and well-being for students to be together at school and to be learning, and for the support that it provides to parents to be able to get back to work again, which is important for family well-being and for their economic well-being. But I think that the question of getting to school by bus is part of the risk that needs to be managed, and it will contribute some risk.
Can I follow up with that?
Mm-hmm.
Certainly.
Yes.
Now, should there be a child who develops a positive case who's on the bus,
mm-hmm.
And does that mean that everybody who rides the bus, and then everybody who is in all of those children's families, and everybody who is in the classes of all of those children, do they all have to go into quarantine?
So that would be speaking to the content of the guidelines from the province about COVID cases and outbreaks in schools, which has not yet been released, though I did cite that I've had a review today of an embargoed copy. For certain, the schools would be providing us with all the contact information of a student who becomes a case. So their class that they're cohorted in, and the members on the bus, and if they happen to be in some other groups, club or something, that we would get that information. The school would be keeping that information and would provide it to us, and then we would follow up with the student in order to get as detailed a history as we can as to the when they were in those environments, how closely did they interact with individuals. There is the potential for the entire class to be excluded for the incubation period of 14 days in testing. There's a potential for those on the bus, some, if not all, to be excluded for the incubation period and for testing. We wouldn't be requiring additional members of their family as contacts to be excluded. At least I don't believe we would at this time, but I think there is the potential for a significant number of people to end up in isolation as a follow-up to a case, yes.
Oh, great. Okay, thank you.
Thank you, Adrian. Nathan Schubert from Moose FM, do you have a question?
Yes, I do. afternoon.
Good afternoon.
Dr. Gardner, we heard reports of reinfection of COVID-19 over in Europe, and I was just wondering, is the health unit concerned at all about reinfection of COVID-19 here at all? And if so, what does that say about building immunity to COVID?
So my understanding from a media report of a case study is that there was an individual from China who had traveled from Spain who had been a case earlier in the year, mildly symptomatic, and then upon retesting with the travel had been found to be an asymptomatic case, and that the strain, there was a difference in the strain between the initial infection and the follow-up infection. But all of that is from media reporting, so I don't have better information than what I've read in the media. But I would say that the potential for incomplete immunity and reinfection has always been something that's been possible, something that we've said we need to understand as we learn more about this virus. It potentially could have implications about long-term immunity. We'll just have to learn more and see. You can get a different profile of immunity with vaccination as opposed to infection. You can also potentially have a different degree of immunity if it's a mild infection versus a more serious infection. There's a potential for this virus, like any other virus, to mutate and change its immunogenicity over time. We've also noted the potential for a drop in the antibodies that people circulate post-infection beyond 3 months. After 3 months, there's a potential for that to drop. So I think it's an important thing for us to learn from, but at this point, it'd be hard to make any firm conclusions otherwise.
Okay, thank you.
You're welcome.
Thank you. Thank you, Nathan. Aileen Doyle from CTV Barrie, do you have a question?
I do, yeah. Dr. Gardner, you mentioned that you've received an embargoed copy of the recommendations for how to deal with an outbreak.
Mm-hmm.
One, are you satisfied with it? And two, do you know when that will be public and we'll be able to know what that response is?
My understanding is that it will be released within 24 hours. What I saw of it was that it was a very solid document.
Okay, so you are satisfied with what you've seen so far, at least?
Yes.
Okay, and then I just have one other question. It's about unlicensed and licensed child care centers or care centers. What is the policy for home-based licensed and unlicensed care providers in terms of wearing masks and eye protection?
I would like to look into that further and get back to you about that detail if I could.
Okay, no problem. It's for a story tomorrow, so I'll reach out to Kathy and we can coordinate.
Okay.
Thank you. Okay, thank you, Aileen. Chris Simon from Barrie today. Do you have a question with Dr. Gardner?
Thank you very much. Dr. Gardner, there's been some talk about maybe the development of a saliva test. Wondering if that may eventually be implemented around here and whether you think that that could have a positive effect on people's willingness to get tested.
So certainly having a nasopharyngeal swab taken is very unpleasant. And we find in particular young children are very distressed by it. And usually it's very, very difficult to have have a repeat test done in a young child. And I'm sure there are many adults who would avoid this as well. So clearly it would be helpful to have other options. We do know that having a throat swab can be an alternative, but it's less sensitive. You're more likely to have a false negative if you just get a throat swab done. So we sometimes advise that as an alternative for young children, knowing that it's not as accurate a test. So if we had other options such as saliva, provided that they would have a good test profile for their accuracy, that would be beneficial, it would be helpful. At this point in time, we don't have that available to us. certainly we would need the direction of Public Health in Ontario about the use of such a test. And we'd need to take our direction from them as to when we'd be able to do testing in that kind of a way.
And then just a follow-up on the outbreak at the very long-term care facility. Just curious to know why it's just the second floor being tested, and also if you have any idea how many residents are at that facility.
Okay, so the location for outbreaks is always done based on the history that we obtain, and so for the staff person in question, that's where they were working and didn't have contact otherwise, and for that matter, we didn't note any breaches in infection control practices either. So if we are very fortunate, and there won't be any further transmission, but in the meantime, we need to maintain all the control measures and the surveillance to watch out for potential cases and to do the testing that we're doing. As for numbers, the facility has a total of 56 residents on the second floor, or 143 in total, and a total of 220 staff.
Thank you.
You're welcome.
Okay, thank you. Elizabeth Smith from Rogers, do you have questions for Dr. Gardner?
Yes, I do. Thank you so much. Dr. Gardner, my question is specifically about just going back to school, and when they go back to school, we know that cold and flu season kind of kicks up. Mm-hmm. Is there anything that you're concerned or worried about in that aspect? And I guess that part two of that would be, are you going to increase testing sites once school returns?
Well, I'll answer the second question first. The availability of test sites falls under the mandate of the Central Region of Ontario Health. And I don't believe at this time that they have plans to increase the numbers of those sites. It's certainly done as a community effort with hospitals and family health teams assisting in organizing and housing and running them and providing the staff. So very much the community comes together to create those sites. I'm aware that if we have a situation that requires a large number of people to be tested, such as a large, a class or several classes in a school or an entire school, that Ontario Health Central Region has the ability to bring in a mobile testing unit to be able to set up in a community location to be able to do testing to respond to the needs. So that is part of their thinking right now if it comes to that. Sorry, could you repeat your first question?
Sure, no problem. Are you worried or concerned about cold and flu season?
I am.
And the fact that those symptoms might be thought to be COVID symptoms?
Yeah, so if we very good question. So indeed, flu season is coming, and we have the potential for a fair number of students and teachers, for that matter, being off, isolated, awaiting test results, and you'll probably have a higher absenteeism rate in schools this year because of that. Everybody's going to be erring on the side of caution, which they should, while testing helps to sort out potential cases of COVID and determine whether or not that's what we're dealing with. I think it will lead to more testing in general in the community if you have circulating cold viruses or influenza, those are all cases where people are going to be seeking testing to sort out whether or not they have COVID-19 to allow themselves back to work, for example, once their symptoms have cleared and not have to wait the whole 14-day incubation period with COVID-19. And so it'll play out the same in schools. It may be that with our public health measures in the community with physical distancing and hand washing and mask use, that we have a significant reduction in those viruses as well. That was the experience in the southern hemisphere in Australia, for example, earlier this year, that they had a tremendous drop in influenza because of the control measures, along with controlling COVID-19 was a control of those other viruses. So it's possible that we'll see less of that. And also there's going to be a strong push on the influenza vaccination this year as well to help reduce confusion about cases of influenza being confused with COVID-19. If people get the flu shot and then do all the other measures, they're going to reduce the likelihood they're going to get influenza and then reduce the potential for confusion about COVID-19.
Thank you. Okay,
You're welcome.
thank you. Eric Engel from Collingwood today, do you have a question for Dr. Gardner?
Yes, I wondered where the health unit was at as far as hiring those 20 school nurses. And if there was going to be a return of vaccine clinics in schools once those nurses are hired.
So 2 very good questions. We are just posting now for the first 5. We're reviewing our finances and determining whether or not we're going to take a more accelerated approach. The last time I spoke, I think I mentioned that we were going to be 5 posted and then another 4 in 3 weeks. But we'll actually have a look at that and see if we want to do it in a more accelerated way. With regards to school vaccination, we were unable to complete the grade 7 vaccine series in the spring because the schools were closed and our staff were redeployed to responding to COVID-19. So we need to get back into the community, preferably into the schools themselves, to do a catch-up vaccination series on those students who missed their vaccines. And we need to look at how do we carry on with those vaccinations for the next cohort of students that would be due for their vaccination as well. So this is something that all health units are grappling with, and I've been in communication with my colleagues throughout the central region of Ontario. And all are planning on proceeding in some way, whether it's in schools, whether it's during school hours or after school hours. That's something we need to get support and permission from our schools and school boards to be able to do that, or whether we need to be doing it in another place, another community setting, or in our offices. But we're fully committed to getting that done later in the fall.
Okay, I also noticed on the health unit website, in the Outbreak section, there's 3 child care centers with unknown respiratory outbreaks. Is COVID testing being done? Have any results come back?
COVID testing has been done. We hadn't had any positive results come back as yet. We continue to manage them and investigate them.
Okay, thank you.
You're welcome.
Thank you, Erica. Do we have anyone on the line from the Huntsville Doppler? Or from Muskoka region? Or would it be anyone that we have missed? Okay. Hearing no one, we will bid you a good afternoon, and we will talk to you all next week. Thank you very much.
Bye-bye.
Thank you.
Information and guidance to anyone who needs it, to the school boards, the schools, the parents. Make it broadly available to respond to reported cases of COVID-19, to work with the school and assess any such cases and exposures in the school environment and identify contacts to be isolated and recommended for follow-up